Hi, this is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. Internationally, we've been affected by this pandemic of COVID-19. We've talked a lot about what's happened in the United States, and we're reaching out to one of our colleagues, Theo de Rijk, who is an associate professor in Amsterdam at UNC, one of the leaders in European urology, to just give us a comment on an outstanding publication they just had, some 80-some pages. Head author is Jason O'Dowd from Aberdeen, on sort of triage with COVID-19. Theo, welcome, and our audience is anxious to hear what your thoughts are about this publication and its impact.
Well, thank you for this invitation, Dave. And of course, it's a huge task that the Guidelines Committee, the EAU, did by composing this extensive 80 pages publication. And I think it's especially good because speaking for the urologists, we need some guidance in how to cope with all these problems about the new pandemic that we are all confronted with, and especially also all the rules that are put onto our practice, because that has a major impact not only for the urologist but also for the whole hospital and especially for the patients also. And reading through this document, of course, you can have some problems with it, because most of the rules are also national, and that's the problem a little bit in Europe. You would hope that we would have in Europe one common direction to deal with this pandemic. But unfortunately, this is not the case, and so that's why in different countries there are different rules about personal protection and everything, how to deal with the patient, also how to diagnose the corona in patients. Some do a PCR test, and others say, okay, we do a CT scan. And some say, okay, you have to do that 2 weeks before, or you have to repeat it just before the operation or admittance to the hospital. So this makes it a little bit complicated. But in effect, this publication helps to guide the urologist in how to deal with patients.
Well, this is, thank you for that high-level overview of this. It really goes into a lot of different areas, and I think it's a great reference paper, and we're going to make the link available on our website. How did you pull this off logistically to get all these people involved in 80-some pages out this quickly and published?
Yeah, it was mainly done by teleconferencing, of course, and because there are different guideline committees, and everybody has every committee works always on a yearly basis together in updating the guidelines, and so there's a good communication between the people, and that's how they could compose this publication, I think.
Well, this is a real Herculean effort, and I applaud you and all your colleagues in EAU. They've always been on the cutting edge of things, and to rise to the occasion and to get something, guidelines out like this is helpful not only to European urologists, but I think that we in the U.S. and other countries can look at it too. Theo, thanks a lot for your time, and any parting comments before we sign off?
Well, what would be interesting, I was just the last 2 weeks I was involved in an international accelerated Delphi consensus view on how management and elective prostate surgery and risk of reducing transmission of COVID would be was reconfigured in different hospitals around the world. And this This will also result in a publication soon, I think, because I saw the first draft already. And I think this will also be helpful in guiding people how to deal with it.
Oh, that's great. Well, let us know when that's out. We'll make sure that we link it. So thanks
Yes.
a lot. You listen, I know it's later there in the day. It's evening, and thanks a lot for your time.
You're welcome. Was appreciated.